You are watching the Doctalk show.
Welcome back from the break. Very interesting discussions, and we are seeing your questions coming in. I'm sure a good number of them will be answered before this show ends. So, Dr. Driwale, as Minister of Health, and you in particular in charge of vaccines, we are in the month of October, and you have the Integrated Child Health Days. A bit of the history. We know we've had routine vaccinations, but when did the ministry now think about having these Integrated Child Health Days? Very short period, but big impact.
Yeah, you know, the immunization services in this country has been evolving over time. The program was established in 1983.
Oh.
But before that, there was no established program that a child born has immunization as an entitlement to protect him or her from a certain set of diseases which were known. So what was happening before that was you get an outbreak of measles in one corner of the country, you get a humanitarian response. You find polio outbreak in a certain area, you get humanitarian response. And if there is no outbreak, you stay.
Oh, yeah.
You get the measles, it affects those it can affect, it leaves
The
those
ones who
it can
survive,
leave.
they go away.
So it was this chaotic kind of approach to service delivery. But the year 1983 was a year when this country was in turmoil. The economic situation was not good. Health system was weak. And in terms of even availability of services available, it was very difficult time. So the program, with the good intention, could not take off. Now, in 1987, the government which came to power, which is NRM, they had prioritized prevention of diseases as one of the items on the 10-point program. So when they found there was a program which was not being well managed under the circumstances at that time, it was prioritized. So His Excellency relaunched the UNEPI program, and it galvanized the support from all actors, WHO, UNICEF, and other actors, so that it was clear that the 6 killer diseases were diseases which were now prioritized, and every child born should be systematically provided this service.
I see.
Now, along the way, we have been struggling with ensuring that every child is vaccinated. Our figures have been growing over time. Out of the 100% children targeted, you would start from 35, around 80, 85, 86, 35% to move to 60. Now we have reached a point where the coverages are stagnating at around 85%.
And that's somewhere.
And that is that is now closer to target. But a country which is very stable, a country with well-set systems, very highly decentralized structures, we are not using all the apparatus available to us to reach every child. So what we do during the Child Health Days, this is something now which came up in around 2000, 2005. It came up as an effort to boost the effort to reach every child through an intensified activity, where you say, let's get closer to people, let's mobilize specifically for this activity so that every child has access to this service, including other services for mothers, and including health education services for the community. So the Child Health Days were born so that you provide an integrated package of services for maternal and child health and survival.
So by getting closer, you mean you go to schools, you go to places of worship, you go to the health centers.
Yes.
Where do these activities actually take place?
Right. So for good service uptake, we look at the supply side of the health system, where the Ministry of Health and government, they put resources and acquire the supplies to reach people with services. But at times the communities do not go to the health facility. The communities do not go to the health facility. Therefore, we are providing a unique opportunity to be closer to the communities themselves, so that we take these services where they are not available closer to the villages. Closer to the villages, we mobilize parents and caregivers to bring children to places which are designated closer to them, and we involve local council to mobilize. We also involve village health teams. We involve parish chiefs and health assistants to ensure that when the health facility staff go to the community is ready to receive this service.
I see.
So this is now the intensification. And also for this particular period, we have also reinforced and instructed all health facilities to provide immunization services daily. Our observation has been that some facilities with all that is required to provide services vaccinate once in a week.
Or once every fortnight?
Once every fortnight.
Or they make a monthly visit
exactly.
to the outpost.
So in this way, the investments we make as government in health facilities, in cold chain and so on, lay redundant. So you are only using about 15% of the capital or fixed investments for immunization.
So that means any day, any time is immunization day,
exactly.
Immunization time.
So that OPD, a child who's brought to the OPD, even if the reason is malaria,
yes,
the clinician should also say, this child is below 1 year, did he get vaccination? Looks at the card and refers the child to the immunization wing, which must be functional at that time. And also from the wards, also from the maternity wards. So this is an intensified activity, and we would want this from now on to continue in this way, so that we reach every child. There is no excuse for any child in Uganda not to be vaccinated, because it is possible.
I see. If you're interested in the age of the host knew the answer to what is UNEPI in full, and he was born in the year that the program first failed until it was rejuvenated. So that's a trivia for you. You can work out the host's age. Impact of COVID. COVID has been with us, and definitely the first half of the year has gone very much to the impact of the lockdown. How much has this affected vaccination efforts in the country? So
once again, I want to say our health systems are resilient, because during the lockdown, we did not see total interruption of services. Services continued, but we saw reduction. We saw reduction by 21% in the month of April, but there has been significant recovery since that time. So what we see is that out of the 21% reduction in immunization coverage, only 6%, we observed 6% in the immunization levels carried out in health facilities, static points.
I see.
What was affected was outreach, and we saw a reduction by 15%, making the 26. So this COVID impacted on not reaching all our targets of that month of April, and but the subsequent months we have seen a catch-up, and the children who were missed, many of them are coming, but not all of them. And in the month of October, we are putting specific emphasis to ensure that the children are brought, and we update the immunization status moving forward.
Oh, thank you very much. How are these days different from routine immunization? I mean, if I'm a parent and I follow to the dot the national immunization schedule, and my card is ticked with flying colors, is there any other benefit for me coming to these integrated child health days related to,
Now,
that may not be necessarily related to vaccines? Is there any other benefit
Yes.
for me as a person?
Now, integrated child days, we said it is for catch-up and it has a service package. So routine immunization is one. Deworming of children below 15 years is another. For children who are 10 years, we are vaccinating against human papillomavirus, the major cause of cancer of the cervix. For regions in the Ankole, Toro, greater parts of Buganda, the southern part of Buganda, and Ankole, Kigezi, we are specifically, in addition to this package which goes to other parts of the country, we are introducing hepatitis B screening and vaccination. Those who are found positive will be further investigated to see if they require treatment. Those who are negative will be vaccinated so that hepatitis is not any one of their diseases moving forward. We will only encourage that each person should complete the 3 doses which they have started. For children who are below 5 years, we are also providing vitamin A supplementation to against preventable cause of blindness.
So I see that you have a very big package coming up for us.
Yes.
Dear viewer, don't go away as we go for this short break, because I have something for the young, something for the middle-aged, even the older persons. We have a package for you that government is planning, and it's good that you actually participate. You do not need to be a child to go for these integrated health days. You will benefit in getting screened and go away with a vaccine that might save you from a very serious condition, such as cancer of the liver or scarring of the same organ. So as we go for the break, we hope that you will be fine. Keep social distance, put your mask on, and sanitize your hands or keep them clean. COVID is here, but life must move on, and keep safe.
You are watching the Doctalk Show.